In 2012, the legislators of the state of Hawaii and the governor took a proactive stance and passed Act 197, establishing Hawaii's first concussion law. This law had 4 directives for high school athletics. The first directive is to have an annual concussion education for coaches, administrators, parents, athletes, officials, and educators. The second directive is immediate removal from play when a concussion is suspected. The third directive is a concussed student must obtain a written medical clearance from a licensed healthcare provider prior to returning to academics and athletics. And the fourth directive requires that the athlete follows a gradual return to play protocol. On July 2016, Act 197 was amended to Act 262. Act 262 included youth athletes 11 to 18 years old, and also to provide support to the University of Hawaii College of Education Kinesiology and Rehabilitation Science Department to provide concussion education and awareness, provide cognitive testing, and concussion monitoring.
I think when we first started this journey to take a look at creating a concussion law in Hawaii, it was about trying to be proactive and trying to make sure that when we were looking at this, it wasn't going to be in response to some kind of tragedy. We wanted to take care of our kids. We wanted to make sure our coaches, our athletic trainers, our parents had all the information that they needed to help keep our children safe and to have fun and to play and to be involved in sports, because we need them to get outside. And so it was really about looking at what the rest of the country was doing and pulling on some of the best practices and current laws and putting it into our own statute. But what was equally important for us as well, and we understood at that point, was you can't just put words on paper. You know, you really had to make sure resources were there as well to be able to carry out those laws and to make sure that we could get the data that we needed to see how our children were doing, make sure that that baseline testing and all that other information could be there. It doesn't come for free, and so it was really about making sure that the law was in place and the resources were provided to do this right. So there were a number of different things that we looked at as we went through the process of creating the law, and in terms of what are the best practices and current practices that were out there. And what ended up being passed in the law was actually, first and foremost, making sure that if an accident occurred, immediate removal from play was first and foremost. Again, safety of the child, of the athlete, is of the utmost importance. Training was also a critical thing. A lot of times people think, well, I did it once, I know it forever. It is about making sure that people are constantly reminded what are the signs and symptoms, what should be done as soon as something happens. So making sure that that is kind of repeated over and over again, kind of like training. For any athletic sport you play, you need to make sure you are armed with the best information, the most current information. So making sure that you have those annual training requirements for parents, for coaches, at the school level, for anyone who comes in contact with student athletes, that was really critically component as well. There's many different components that are in the law, and I will say this about legislation, is that it's a constantly evolving process, in the sense that it started off with one bill in 2012, and it was about looking at where we were and meeting and looking at the data and where we wanted to go, and then actually coming back in 2016 and passing the next step in terms of, okay, we started with high school sports in our public schools and even with our private schools support, but now where do we go in terms of youth sports, because that's the next level of play, and needing to expand the universe to really keep our children safe, to give parents information that they need to all work together in this, because at the end of the day, these are our kids. So it's a constantly evolving process with us looking at the various pieces of the law that we first started out with, in terms of making sure that you had the training and the outreach, that you had the proper testing being done, and the resources to do all of this, because again, it is important that you do this with some level of fidelity. And I think it was a result of looking at those basic components of the law and where our children were playing and accessing sports, that it was a further discussion about, okay, what is next? And going on to the next step of legislation that we passed in 2016, going into then the youth sports arena. and understanding that our athletes are so passionate about their sports that they play at school, they play in the community. How can we be working together to expand that outreach, to expand that testing, the access to data, compiling that data? And so that is still, even today, in the process of really being executed with fidelity and implemented. But it is a constantly evolving process, I think, when you look at laws in terms of all the various pieces. And where do we go next?
Every state in the United States has a concussion law on record. In some form or another, all have three things in common: concussion education and awareness, immediate removal from play, and medical clearance before returning to play. These laws are designed to prevent second impact syndrome.
Second impact syndrome is somewhat of a controversial diagnosis, but essentially it's a brain injury that you sustain after already sustaining another brain injury that you're not yet fully recovered from. The danger is it causes a catastrophic swelling of the brain, and it's one of the main reasons why we're so careful about making sure someone's completely over their concussion, which is a kind of brain injury, before sending them back out where they could sustain another blow. So it's thought in second impact syndrome that when the brain sustains a second injury while it's still recovering from another, that the brain loses its normal ability to quote-unquote auto-regulate the blood flow that comes in and how much pressure is inside the brain. And over a really short period of time, it can be seconds to minutes, the brain can sustain significant swelling inside the skull and cause catastrophic injury.